Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to speak about a common shoulder condition called internal impingement. You may see this written as posterior internal impingement or just internal impingement. Either way, it is the same condition. Oftentimes it may be abbreviated to PII when someone is using the name posterior internal impingement. This is a common injury among overhead throwing athletes. You think about baseball pitchers, javelin throwers, volleyball players from serving. This is a condition where there is pain and stiffness in the posterior aspect of the shoulder. The pain and symptoms of internal impingement of the shoulder occur due to compression of the tendons of the supraspinatus and infraspinatus tendons between the greater tuberosity of the humeral head and the posterior superior aspect of the glenoid. Now, what does that mean? That means that the two tendons in the rotator cuff, the posterior aspect of the rotator cuff, the two higher muscles, the supraspinatus and the infraspinatus, their tendon gets compressed between the head of the humerus, which is the arm bone, where the humerus articulates with the scapula. And the glenoid is the aspect of the scapula where the humeral head attaches to. And so what happens is the humeral head becomes posterior. It is what's called hyperangulation, where really the whole shaft of the humerus is posterior to the body of the scapula. And this pain and symptoms usually occurs when the shoulder is in what is called abduction and external rotation at the 90-90 point. 90 degrees of abduction and 90 degrees of external rotation. Often you may see this written as ABER, meaning abduction and external rotation. In this position, the humeral head, which is this bone, the humerus is this bone right here, the head of the humerus is the very top part of the arm bone, that it is shifted backwards, and it is causing compression of the tendons of the supraspinatus and the infraspinatus. The pain and symptoms of internal impingement of the shoulder usually begin as stiffness, especially in the back part of the shoulder, posterior in medical terminology, and it usually causes the athlete to have a longer warm-up period. And as the condition progresses, then pain starts to develop in the posterior aspect of the shoulder, especially when they are in the position of 90 degrees of abduction and 90 degrees or greater of external rotation. And then as it progresses further, this pain is felt throughout the day, even when the athlete is not participating in a throwing motion or a serving motion. Throughout all phases of this condition, there is a reduction in performance. Almost everyone who suffers from internal impingement of the shoulder also has a condition called scapular dyskinesis. Scapular dyskinesis is either an abnormal motion of the scapula or an abnormal position or posture of the scapula. The scapula is the medical name for the shoulder blade. There are muscles that attach from the spine to the shoulder blade. These muscles are called the scapular retractors. They originate on the spine and they attach to the medial border of the scapula, and they pull the scapula towards the spine. This motion is called scapular retraction. The muscles that perform this motion are the rhomboid minor, the rhomboid major, and the middle aspect of the trapezius muscle and the lower aspect of the trapezius muscle. If these muscles are weak and they cannot hold the scapula in a stable position when the athlete is throwing, this leads to a large number of conditions. It can lead to rotator cuff conditions, it can lead to condition of the long head of the bicep tendon, and it can lead to internal impingement and also to subacromial impingement. In the case of internal impingement, almost all athletes who suffer from internal impingement also have scapular dyskinesis. As a doctor of chiropractic, I have seen this condition in my office many times. What I do when a patient comes in and they are describing that they have posterior shoulder pain, I look at several different things. I look at the posture of the mid-back and the neck, known in medical terminology as the thoracic spine and the cervical spine, respectively. I look at the posture of the scapula, and I look at the posture of the shoulder. And then I also look at how these areas move. We want to review and look at how someone moves, evaluate their motion. Not only when they are playing, but when they are sitting, when they're standing, when they're throwing, when they're doing exercises. I want to look at how the cervical spine, the thoracic spine, the scapula, and the shoulder are functioning. Many times people who have internal impingement, they have a greater muscular development on the side where the impingement occurs at, on their throwing side. Usually that side is the shoulder is a little bit lower than the opposite side. And many times they also have other conditions along with the posterior shoulder pain and stiffness. In most cases, when someone has internal impingement of the shoulder, they have an excessive amount of the external rotation of the shoulder and a limited amount of internal rotation of the shoulder. So that is also something that I look at during the examination. Now for treatment. If you think you have this condition, if you are starting to feel symptoms of stiffness and pain in the posterior shoulder, do not hesitate. Seek professional treatment immediately. The sooner that you seek treatment, in most cases, the shorter your recovery period will be. Not in all cases, but in most cases. So if you start to feel pain or symptoms, as I described earlier in this video, seek professional care. As I said, as a doctor of chiropractic, this is a condition that I have treated in my office. I would treat the cervical spine, the thoracic spine, get those areas adjusted, get the proper motion and the proper nerve flow going through the cervical spine and the thoracic spine to the shoulder. I would look at how the shoulder blade sits on the thorax, which is called the scapular thoracic joint. Get those muscles loosened up, get that area adjusted, and I would also concentrate on the rotator cuff and the entire shoulder girdle, what we call the arm trunk mechanism. Often you will see the term shoulder complex, and that is a true term because the shoulder is very complex. There are 4 joints in the shoulder. So we have to look at the entire chain, starting from the spine, going to the scapula, going to the shoulder, and even below the shoulder into the upper arm. So if you have this condition, seek professional care as soon as possible. Now, some self-treatment things that you can do. You can really help yourself out with this condition. One of the things that I mentioned is that most people who have internal impingement of the shoulder suffer from scapular dyskinesis. How do you combat scapular dyskinesis? Is that you strengthen the scapular retractor muscles. Perform scapular retraction. You can do it with just body weight, and then as you progress, you can do it with resistance from a cable. You can work on the rhomboid major, the rhomboid minor, build the middle trapezius and the lower trapezius. You can also stretch the posterior aspect of the shoulder, moving into internal rotation. This is called the sleeper stretch. Now I have a video on the sleeper stretch. Let me go back a step. I also have several videos on scapular retraction. So I will put those videos, links to those videos in the description box below, and I will also put links to the videos for the sleeper stretch. The sleeper stretch is very important because it helps to stretch the posterior aspect of the shoulder capsule. This will help to take off and lessen the compression on the tendons of the supraspinatus and the infraspinatus. So a couple things you want to do. First of all, if you have this condition, seek professional care. I recommend you see a doctor of chiropractic like myself. Do self-treatment. It's very important, very important. Strengthen the scapular retractor muscles, again, the rhomboid major, the rhomboid minor, the middle trapezius and the lower trapezius, and strengthen the posterior aspect of the shoulder by performing the sleeper stretch. Also, once you have progressed, you can work on exercises such as the reverse fly or the standing pulley reverse fly. These will help to strengthen the posterior aspect of the deltoid muscle, and you can also strengthen the posterior rotator cuff muscles. The first thing you want to do, though, is get professional care. Make sure that that is your diagnosis, because you get the correct diagnosis, and that leads you on the correct path for your rehabilitation. And then if you are diagnosed with internal impingement, start to strengthen the scapular retractor muscles and start to stretch the posterior shoulder using the sleeper stretch. Then you can advance to strengthening the posterior deltoid and strengthening the posterior rotator cuff muscles. A couple other things that you need to realize is throwing is just not a shoulder and arm motion. It is an entire body motion. So you want to strengthen the entire body. You need to strengthen the legs, you need to strengthen the pelvis, you need to strengthen the entire core, all of the abdominal muscles, strengthen the back muscles, all of the spinal muscles. Work with a throwing coach or a professional who can help you to develop better throwing mechanics, and work with a rehabilitation specialist who can help you to strengthen all of the muscles that you need to strengthen and stretch the muscles that you need to stretch. Thank you, everybody, for watching today's episode of Dr. Ozello's Sports Medicine Report, where I covered internal impingement of the shoulder. Again, internal impingement is also known as posterior internal impingement and may often be abbreviated to PII. Thank you for watching. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Please feel free to like this video. Please feel free to leave any questions, suggestions, or feedback in the comment section below. Also, please feel free to subscribe to my YouTube page, Dr. Donald A. Ozello, DC. If you are watching this video, you're on my YouTube page. Also, please feel free to visit my website, championshipchiropractic.com. You can get additional information on my book, you can see my blog, and you can also see other videos that I have. On my blog, I write about sports medicine, health, spine health, fitness, nutrition, all types of subjects that will be helpful for athletes and people of both genders, all ages, and all sports. Thank you again for watching today's episode of Dr. Ozello's Sports Medicine Report. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Always remember, train hard, train smart, get adequate rest between training sessions, utilize nutritional and supplementation strategies that work for you, stay injury-free, and accomplish your goals.